our first webinar for this year. Jumana Nasser and I are gladly coordinating the seminar series for FHS this year for the second year in a row. As you know, it has been a bit challenging to organize these kind of talks, especially online. And with the COVID-19 response, we have been trying to tailor most of our seminars for the to discuss issues related to COVID-19, whether lockdown strategies, exit strategies, infodemic, and epidemiological trends or otherwise. Today, I am very happy to introduce a group of speakers who have worked together to develop an application for contact tracing to support the Ministry of Public Health in Lebanon. So I will quickly read the title of the seminar and introduce the presenters one after another so that I hand over to Ms. Aline Germani, who will be handling the presentation, and Dr. Imad Al-Haj, who will make a quick introduction before going into the details of the presentation. So the title of our seminar today is Together Against Corona, a multidisciplinary collaboration to develop Lebanon's COVID-19 contact tracing app. Our speakers come from various backgrounds. The first would be Lina Abu Mrad. She's the director of the National e-Health Program at the Ministry of Public Health, with more than 20 years experience in the field of health information system, and a lecturer at the Faculty of Public Health in the Lebanese University, leading e-health and digital transformation projects to create new business models to promote transparency and ensure modernization of the administration. He is a member of several national committees, including COVID-19 crisis, digital transformation strategy, good governance, unified e-prescription, drugs traceability, and fighting corruption. Lina received many awards and special distinction from ministers of public health for developing digital platforms to improve the quality of healthcare services. Our second speaker will be Dr. Marco Bardus, who is an assistant professor at the Department of Health Promotion and Community Health at FHS. He holds a PhD in communication sciences with a focus on health communication from the Università della Svizzera, I hope I got this right, USI, University of Lugano. His research is aimed at understanding how persuasive communications and social marketing strategic thinking can be applied in health promotion and behavioral interventions among various populations and settings. His research focuses on the use of digital technology for behavior change. In relation to the COVID-19 pandemic, he is a member of the expert committee on COVID-19 at AUB, bringing his expertise to the service of the institution. He has co-developed a campaign tackling misconceptions about the coronavirus with colleagues from the same department. He is part of the team who volunteered to support the Lebanese Ministry of Public Health in developing the digital contact tracing app called Ma'an, Together Against Corona. Our third speaker is Mr. Heinrich Dohna. He is an assistant professor in the biology department at the American University of Beirut. He is interested in biological invasion processes, including disease dynamics, and applies in his research different methods from population genetics, phylogenetics, bioinformatics, and ecological modeling. Last but not least, Dr. Imad Al-Haj is a professor with the Department of Electrical and Computer Engineering at AUB. In 2014, he co-founded SOGO 360, the first startup to be incubated at AUB. And in 2017, he co-founded the Humanitarian Engineering Initiative at AUB. His research interests are at the intersection of robotics, networking, and human-machine interfacing with applications in health and environment. Dr. Haj is recipient of the IEEE Outstanding Branch Counselor and Advisor Award, the Teaching Excellence Award at the American University of Beirut, and the Kamal Salibi Academic Freedom Award. Imad, the floor is yours.
Thank you, Martine. Thank you, everyone. Can you hear me well? Just to check.
Yes, please go ahead.
Okay, thank you. I want to start real quick to introduce everybody. We've changed the order of the speakers a bit. Sorry, Martine. last-minute change. I'll start by pointing out that this is truly a multidisciplinary collaboration, private-public partnership, and there's a big partner also here that is not listed. We didn't have their logo. Is TEDMOB, is the company that actually did the development. And this here, thank you, Aline, is the list of the primary, I should say, team members, because there are many other individuals in the background that are working both at the ministry. Interns at AUB have helped with this, and a very large team at TEDMOB. And whichever way you split this, you could see the multidisciplinarity, whether from public health and engineering, whether from an industrial partner, a professional partner, and a ministry and an academic, or a private-public partnership. So this was really a rewarding experience to all of us. And we're thankful that we have this opportunity to actually talk about the application, and I'll let Lina take over from here.
Yes, thank you, Imad. Good afternoon, everybody. So, as a national, let me first thank you, AUB, and thank you, the Faculty of Health Sciences, for giving me this opportunity to talk about MAN, this project who've been launched from the ministry recently. And I will talk about the reasons why we developed such mobile application and the benefits of having MAN app as well. Next, Aline, please. The contact tracing. What is contact tracing? What is the main purpose of contact tracing? Contact tracing, the main purpose is to interrupt the transmission chains of COVID-19. So to alert persons who have been in contact with an infected person, get notified on how to take preventive measures and on how to take action to prevent a transmission, the infection to other people. So the main contact tracing mainly aims to identify and alert people. And the smartphones and technology, it can be used to quickly and automatically determine whether somebody has been in contact with an infected person. Smartphones are as additional tools as the regular contact tracing being conducted by the Ministry of Public Health, activities mainly by the Epidemiological Surveillance Unit, who has mainly conducting contact tracing from the beginning of this COVID-19 pandemic. But we were facing many challenges at the Ministry of Public Health, mainly the increased number of infected people and the community transmission. As you can see in the two graphs, daily we have above 1,000 confirmed COVID-19 cases. And to for contact tracing, it's being very hard for the ministry with the very limited resources to trace back all the contacts every day. And also we have also many challenges with the opening of the airport and land crossing are opened, and with all the influx of passengers on the last months, also it is really real issues for the Ministry of Public Health. And we can see also people are not respecting anymore the preventive measures, and lockdowns are now being lifted regularly, and the country is open, people are going to work. So these issues, we were trying to find solutions using technology to tackle these challenges. So using technology, and especially mobile applications, can support the contact tracing being used in the ministry and being conducted by the Epidemiological Surveillance Unit. The mobile applications can support this contact tracing as mobile applications. It is an extra tool or additional tool being a proximity tracking and exposure notification. So mobile applications and MAN especially, it can complement but never replace regular contact tracing activities done by ESU at the ministry. And the benefits of mobile applications is of particular significance during this situation now in Lebanon, where containment measures are lifted and citizens are not applying preventive measures as well. Another benefit for mobile apps in the contact tracing is these apps can help and alert more contacts as they do not rely on the memory of the infected case, and can also trace contacts unknown to the case as well. Maybe somebody was in contact of or in proximity of you, but you don't know this person. So this will help in alerting such persons. Another benefit also of the apps, it can also notify quickly more contacts than regular tracing and with less human resources. So with all these benefits, we have been working on MAN with AUB team and TEDMO. MAN is the official contact tracing and exposure notification app for Lebanon. It is provided for free by the Ministry of Public Health. It uses a Bluetooth technology to broadcast the presence of a mobile. It collects only your mobile phone number and other data like the Bluetooth signal strength of the other MAN user and the date and time of contact. It does not collect any geolocation or GPS data. So when a MAN user tests positive for COVID-19, the ministry will either send him a notification or provide him with a code to upload his data to the ministry servers. I will let Dr. Imad explain later on the technology and the data privacy in details later on. Next, please, Aline. Internally at the Ministry of Public Health, this is done in cooperation between the National eHealth Program and the Epidemiological Surveillance Unit, as you can see in the workflow diagram. This interaction between these two departments in order to work on contact tracing, while every day the Epidemiological Surveillance Unit share the confirmed cases phone numbers with the National eHealth Program in order to upload to the server and to generate the list of positive cases using MAN. And this way, and using a risk model script developed by AUB, we can generate the high-risk contacts to be notified by MAN in order to take the preventive measures. And this list, this high-risk contact list, is then shared with the Epidemiological Surveillance Unit in order to help them to conduct the contact tracing and to ensure that the process is well and for further required actions. So with MAN, we can improve the contact tracing activities done by the ministry, but MAN, it will never replace the regular contact tracing efforts due to several limitations. Because, as you know, not everyone will have a smartphone in Lebanon, and particularly the elderly. And not everyone will have downloaded MAN, since MAN is not enforced. It is a voluntary mobile app and it is not enforced by law. And as we noticed lately with the implementation of MAN and the communication with the users, is that some users may not use MAN properly. Sometimes they are not opening the Bluetooth, they are not enabling the push notification. So these issues also it will prevent from the proper use of MAN. And in order to improve and to increase transparency, the Ministry of Public Health has posted and published the source code of MAN on GitHub. So if you are interested to view the source code for MAN app, you can visit the link displayed in front of you. And we are working to form an advisory board from independent experts and NGOs in order to oversee the implementation of the project. So we need your help. Download MAN and help us to stop the spread of COVID-19. Just to let you know that as of 29 of September, yesterday, we have 17,000 plus downloads on the different stores because the app is now available for free on Google Play, on App Store, and on Huawei App Gallery. And we need also to reach out for all the population in Lebanon to download this mobile app. If you need more information about MAN, you can find on the website of the Ministry of Public Health, moph.gov.lb/en/MAN. And thank you. I will let the floor now to Dr. Imad Haj.
Thank you, Lina.
Thank you.
Thank you. Aline, if we can go to the next slide. So I'll talk real quick about some of the technological aspects of the app and associated privacy concerns or features. First, to highlight that, contact tracing in general, there are several options when we talk about contact tracing. There's the telecom data use from operators. So where, somebody like Alpha or NTC or Touch would be able to use our phone positioning on the network to know where our geolocation is and use that data for positioning and for contact tracing. This is used in some countries in the world. In Lebanon, fortunately or unfortunately, this data is not available. This capability of tracing or tracking phone numbers of the population at scale is not possible. Okay, so the second option is to actually go to mobile apps. In mobile apps, there are several approaches. One is what people worry about, and some contact tracing apps do that. They do a geolocation, which means they have your GPS and other features that would allow them to position you and your phone, and this way geographically would be able to know the proximity of individuals. Clearly, this has a lot of privacy concerns. The other technology that is also commonly used is the use of Bluetooth. And the idea with Bluetooth is, as we will see, is that it's a trick to know who was close to you without knowing anybody's position. This is the idea, is that we rely on this signaling to know who was in your proximity up to a certain distance, give or take. And the other speakers will talk about that, give or take. And this way we would know who was in proximity. And therefore, if somebody is positive, we could inform the others who were close by. In Bluetooth, there are several approaches. Either it's completely distributed, and that's really the most private one, which the apps run by themselves, and there is no centralized collection or upload of data in that case, and therefore that requires individuals to voluntarily notify the system that they are positive, and this way the system will figure out who were in their proximity and will notify them. The other approach to this Bluetooth use is to have a centralized system where all the phones are uploading their data to the centralized server. The centralized server will do the assessment and analysis to know if there is a contact and then do a notification. And there's a hybrid. And we went with the hybrid model because given the constraints we have in Lebanon and the privacy restrictions that we wanted to have, we felt that that's the best option. So why is it a hybrid? Is because all the data remains on the phones of everybody. No data is collected ever unless somebody tests positive. When that person tests positive, the data that is on their phone only is uploaded to the server after their consent. And that data is used to figure out who was close to them. So you could see that it's distributed until somebody is positive. Thank you, Aline. Yeah, that's a good time, Aline. Is positive, then that data gets uploaded. So as you can see, step one is people would have to download the Ma'an app, and the apps, when they are in close proximity, they exchange encrypted random numbers that expire in within 20 minutes. You could see this as actual samples of what the phones are exchanging. And the phones, once they are aware of each other, the apps, they log these numbers and they log the signal strength. That is an indicator of how close they were from each other. This data is saved encrypted locally on your phone. And remains on your phone until somebody tests positive. We saw in the workflow from Lena that the ministry gets informed that somebody is positive and this is their phone number. Once that phone number is known, we check the backend server if that individual, they have the app installed. And in that case, the data is uploaded from that positive case. So that's number 3. So the positive Ma'an user, that data that they've been logging about people in their proximity gets uploaded to the server. And by the way, none of the users know each other's phone numbers because what's exchanged are, again, these random numbers. And only the ministry in the back end is able to translate that number into a phone number. Once that translation is done, the ministry is able, based on this data, to analyze the risk of an infection based on a distance and time. And Professor Heinrich will talk about that risk model and eventually identify the sub-list of individuals who should be contacted for them to come in and do a test. And so we could see where this hybrid model and I'm talking about is that the data stays on the phone numbers until somebody tests positive. And then in that case, the data is uploaded for analysis on the server of that individual only. And all these links that you see, by the way, are encrypted links, and data is encrypted on the server, so that we could reduce the possibility of somebody benefiting or looking at this data. So if we look at the next slide, Aline, if we go to the next slide, it's a good point then to talk about what gets saved where and what is included. So from Ma'an to Ma'an, random numbers which expire every 20 minutes, the received signal strength that we use to identify roughly the separation distance, and these are encrypted, and phone numbers are not exchanged. So even if you look at your data, which is encrypted in the first place, you would not be able to discern by the phone number of the individual that was beside you. On Ma'an itself, the data is encrypted and retained for 21 days only, and it starts get overwritten. Ma'an to the ministry, at registration, you only have to provide your phone number. And this, some people point out that this is a concern of privacy, that, the ministry has our phone numbers now. But I have to remind everybody that in Lebanon, the operators are owned by the government, and the data, there's a law that allows the government to have access to all phone numbers. So this data, in a way, is already with all the ministries. And to add to that, all the labs in Lebanon are mandated that when somebody tests positive, to provide their name, their phone number, their address to the ministry. So that data already exists with the ministry. And what goes, if somebody tests positive, as we said, the proximity data goes from the app to MOPH after a second consent, by the way. So they consent at install and they consent at upload. And the last one is MOPH. Data access is only for very limited individuals that are looking at the risk model. And when there is tracing or notification, this is anonymized. So we would tell somebody that you were in contact with a positive case, but clearly we don't exchange the data and we don't inform them who that individual was or what their phone number is. So no one is aware of these numbers in either of the situation, whether they're positive or they're being notified. Second slide, please, Aline, to continue a bit on the issue of privacy and security. So as I mentioned, consent on install and on upload. Detailed privacy policy is published on the MOPH website. You could see that very detailed, informs you what servers, what vendors, what goes where in details. The source code of MAN, as Lina mentioned, is published. I think this is one of the rare cases, if not the only cases, where there's a public project that actually publishes the source code completely openly on GitHub. You can uninstall at any point that you want to delete your local data, and you have a right to forget according to the policy. So if you test positive or you want to uninstall and unregister from the system, you could send an email. There's an email provided. You can send us an email, and then we could ask the administrators to actually delete and forget all your data from the server. And we've mentioned about the advisory oversight committee. Lina mentioned that. The second slide, some technical concerns that usually individuals worry about when it comes to such apps. The app size is very small. It's less than 20 megabytes, if I'm not mistaken. It has very limited effect on battery. It uses the low energy Bluetooth, by the way, and this is the same one that is used by Apple and Google APIs that was published recently. Unfortunately, the app was being developed by the time these APIs came out, but it uses very similar technology, and we've done testing that shows that the effect is very limited on the battery itself. The data that is saved is relatively small. It's in the order of few megabytes of data of exchanged. And the bandwidth is minimal and mainly only when the test case is positive, because data is not exchanged with the ministry server, as we said, unless somebody tests positive. There's a bit of data being sent to the app, these random numbers being generated that I mentioned, these get distributed from the server. And again, this is a very minimal effect on the bandwidth. So the 3G bandwidth is not being consumed by this app. So I will leave now the floor to Dr. Heinrich Dona, who's worked with Dr. Hala Ghattas and others from the ministry and from FHS on developing the digital, the contact tracing risk model for this digital solution, which at the end of the day is the important part of all of this. We want to understand who's at risk so that we could notify them. Thank you very much.
Heinrich, the floor is yours.
Dr. Heinrich, maybe you need to unmute.
Can Jad maybe as a host unmute him? He might be having trouble unmuting.
Maybe
Not available.
You want to...
Okay, I muted
unmuted.
Dr. Heinrich. I think he logged in with the wrong link, so he's listed as an attendee. But now you are unmuted, so you can go ahead and talk.
Okay, thank you. Sorry for that. All right, so I will talk about the how to get from the Bluetooth signal to an estimate of the risk. So if you please could move to the next slide. Okay, so this step from the Bluetooth signal to contact risk estimate involves three components. One is to determine the contact distance. The second one is to determine the contact duration, and the third one is to determine the contact time relative to the disease confirmation. And at least the first two of these components, there are two problems involved. One is what is the effect of this component on the actual transmission risk, and the other one is how to infer this from the Bluetooth signal. The third one, the contact time relative to disease confirmation, the uncertainty is what is the effect on the transmission risk. It's straightforward to infer that from the Bluetooth signal. Okay, so let me talk about the first aspect, contact distance. If you could move to the next slide, please. So here's some data from studies that try to get at that. The study cited here, we et al., is I think is the one that WHO guidelines relied on. So what you see in the lower graph is the vertical location and horizontal location of droplets by different sizes. And so you see that larger droplets drop within 1.5 meters from being expelled. And this is the reason for the 1.5 meter distance guideline by WHO. However, you might have read in the press there is scientific debate about the aerosols. So these are the small droplets, 10 micrometer, and they can disperse much farther. But the question is, do they contain viable particles? Has been shown they contain viral DNA, but it's unclear to what degree this reflects viable virus particles. So. And then there are a lot of complicating factors such as airflow, whether a person wears a mask, the expulsion speed, whether you talk loudly or sneeze, or all this influences in transmission risk, or the distance over which virus particles are being dispersed. The other complicating factor that is shown here is the how we estimate the distance between two individuals based on the Bluetooth signal intensity. So what's shown in this graph is from our calibration trials, where we placed phones at different distances that is shown on the x-axis here, and we measured the strength of the Bluetooth signal. And you see a relationship where shorter the distance, the stronger the signal, but you also see a lot of noise, right? So I plotted the dotted line as the cutoff point that we're currently using. So we only consider signals above that cutoff line. But we get signals from the distance 2 meter, 3 meter, up to 5 meters above this cutoff line. So even though there's a relationship between signal strength and distance, but this relationship is not very clear cut. And then when you distinguish by indoors or indoor separated by a wall and so on, all these are factors that influence the signal strength and blur the relationship between distance and signal strength. So the take-home message here is both the effect of distance on transmission risk and the inference of distance from the Bluetooth signal, both are pretty noisy. But we know that the Bluetooth signal rarely, so a signal beyond 5 meters is rarely picked up. So one is the signal strength and the other one is the signal frequency. Both tell us something about distance. All right, next slide, please. Okay, the other question is how much does transmission contact? How much does the transmission risk depend on contact duration? So if two people are in close vicinity of each other for 10 minutes, or for 20 minutes, or for 5 minutes, how does this influence the risk of transmission? And for this, there are essentially no data, because what you would have to do to infer this is to an experiment where you measure it on the person who becomes infected. So the only data for this question come from animal study of different diseases. And so the only studies that have been done are consistent with the assumption of independent action, which means each virus particle independently increases the risk of transmission. So it doesn't mean that you have to go above a certain threshold to have a transmission, and below this threshold, nothing happens. So according to the assumption of independent interaction, 3 separate 5-minute contacts give you the same transmission risk as 1 15-minute contact. And so we use, in the absence of any data that tell us that this is not a good assumption, we use this assumption for our risk model. So next slide, please. So here is, again, data from our calibration trials where 2 phones were placed in 15-minute, were placed for 15 minutes, either 1 meter from each other or 3 meters from each other. So the lower 3 trials are 1 meter. And you see the frequency at which phones recognize the signal from the other phone. So each dot is here an event when a signal was recognized. And I also show here how our risk model estimates the contact duration. Basically, if the time between 2 signals is less than 10 minutes, our risk model assumes this has been a contiguous contact. So the solid lines show the estimated contact durations. I plotted on the right the estimated contact durations. In all of these cases, the real contact duration was 15 minutes. For longer distance, the estimated contact duration is shorter because the signal frequency is lower. Okay. So next slide, please. And the third component is how does the timing of when the contact happened relative to when the disease was detected, how does this influence the transmission risk? And so what I show here is data of what's called a serial interval. So the serial interval is the time difference between infector showing symptoms and infectee showing symptoms. You can think of that as a proxy for the time interval between becoming infected and infecting someone else. And so when this time interval is 0, then you infect immediately someone else after becoming infected. And so you see most of the serial intervals are concentrated within a few days from showing symptoms. So that means if the disease is detected in a person, the most dangerous transmission contacts were the ones that were logged in the phone a few days prior. But you also see that this distribution has a long tail that can go up to 20 days. So it is still possible to infect, or it happens relatively rarely, but it can happen that you infect somebody long after you show symptoms, or it goes in the other direction too. So sometimes that you infect, there are cases, so and then on the negative serial intervals means a person who became infected shows symptoms up to 12 days in this data set before the person who did the actual infection showed symptoms, right? So it is possible that you can infect somebody up to 3 weeks before you actually show symptoms. So these are rare cases, but at least it has been demonstrated that this can happen. So because of all these complications that I've showed you, we chose the hybrid approach that Iman already mentioned. So if you go to the next slide, please. Sorry, further down. Yes. So our approach is to use a conservative value for the signal strength cutoff. So so that we catch all the short distance interactions, but we might also include some longer distance interactions. Then we add the time intervals of all signals that are not more than 10 minutes apart to estimate our contact duration. And we sum up all contact durations to get an estimate of the total contact time. And we calculate this separately for two time periods. One is 1 week prior to the case confirmation, and the other one is 2 to 3 weeks prior to the case confirmation. And then we order all contacts according to the total contact time, so that what MOPH has available is all the contacts ordered by how much total contact time they had with the confirmed case. And then the people at MOPH who do the tracing decide, based on these data that get returned to them, whom to alert. And so the reason for this hybrid model is, since there is a lot of uncertainty in both estimating the distance, estimating the contact time, but also what distance and contact time actually means for transmission risk, we didn't hard code a particular cutoff point where we say anybody beyond this cutoff point gets automatically alerted, but rather provide an ordered list to MOPH so that they can decide, also based on personnel constraints and other considerations, what people to focus on. The idea is that this is an iterative process. So after we collect more data from, after more data come in from many users, both MOPH, the people at MOPH who do the contact tracing will develop a better sense of what are the important cutoff values beyond which there's a high transmission risk. And we can later on then do an additional analysis based on the data to see whether we can refine our current risk model. Okay, so that's it for my part. Thank you very much.
Hello, I think this is the cue for my intervention. Thank you, Heinrich, for the presentation so far. Aline, can we go to the next slide? I want to give my outline here. So I want to talk about now how we came up with the name. So developing the name together with the team in the Ministry of Public Health, and how we developed also the communication marketing strategy, at least as a major outline here. And then I'll conclude focusing on the pillars that characterize the work that we've done as a team, working together for the MAN. So first of all, I started thinking about what is a name, what should be in the name of this contact tracing application. And to go and to do that, we analyzed and adopted by countries in the world. So we can go to the next slide, Aline. We systematically reviewed about 115, actually not about, exactly 115 applications to date from May 17. So we searched and we identified all the contact tracing applications that are currently available in the world. So we use a systematic, evidence-based approach in identifying these applications for two reasons. One, to get the benchmark, to understand how other countries have done. And then second of all, also to see how the application can be configured, and the same also time how to promote it, how to make it available to other users. We looked also at the applications available in the Middle East, in the Arab world. Next slide, please. This is just the detail we're doing. So we're analyzing the permissions and privacy policy. See, we identified 16 applications from countries in the Eastern Mediterranean on the Arab world, including the UAE, that has 2 applications. So the Gulf countries, Saudi Arabia, Iran, Turkey, and so on. So We looked at how they promoted themselves, how they used the name, what the names were. Next slide, please. Here I presented a tree map of the themes related to the name. So as you can see, the biggest portion of the screen here, the blue part, is related to the virus name. So 61 applications of the 115 have COVID-19 or coronavirus in their name. Some of them mention the virus alone as a virus radar or something like this. And the second major theme here is the concept of protecting or tracing. So the contact tracing, tracking, using safety, protection, care. These were the themes related to that part. And then there were some other minor themes, so minor numbers of limited numbers of applications that were talking about awareness, being alert, being watched, and detecting the virus, and so on. A few 9 applications were considering the concept of community tracing, togetherness, like the famous Blue Trace protocol from Singapore. It has been widely used as a benchmark worldwide. At the same time, it's also been criticized for some privacy violations, potential privacy violations. Next slide, please. So we convened with the Minister of Public Health, with Ms. Lina, and we discussed also with the Director General at that time, and we discussed, what are the options we are available here. So we want to, in a sense, follow the trends in the world, and so we want to have somehow the tracing, the safety protection concept in the name. We want to have the name Corona, so we want to identify this as a contact tracing for COVID-19. And we also want to appeal to the community sense and the togetherness. So because we want to provide a sense of community that we have, let's say, in this part of the world particularly. So not appealing only to the individual protection or to the individual safety, but also to the community, to the sense of community. Next slide. So we had a long discussion. We had also a long process. We followed like a 2-step process. We had independent ratings. We had different teams rating the name options. We evaluated about 19 overall. And then we shortlisted the most voted ones, the better, the ones that receive the higher ratings. And we came up with the Ma'an, and this is the logo that we have recently approved. Next slide. Now, how do we position our brand, our products, when it comes to comparisons to other contact tracing application developed in the Arab world? So we can go, the continuum here is from English only applications that are done and written completely in English to those who are written mostly in Arabic or completely in Arabic. So we can see here in the presentation here, there's Trace COVID from the UAE, from Abu Dhabi. It's mainly in English. Of course, if your operative system is in Arabic, you can set it in Arabic, but the application name is in English. Then you have a mix of applications that have let's say their name is in English, or it's a transliteration of the Arabic, but the logo has the Arabic name translated in a sense. So, like for example, the Aman application from Jordan. And then you have the Bahrain, be aware Bahrain, or the application from Morocco. Wikaitna. I'm sorry if I pronounce it wrong. My Arabic is not good. At the same time, so this appeals to different communities. At the same time, they appeal to different target groups. So we thought in Lebanon we have, mostly Lebanese, of course, citizens. We have people speaking Arabic, comprehending Arabic, of course, but we have to appeal to the international community of travelers, for example, or people like me. They are residing here that will not understand much the Arabic, and so we thought about using the man with the logo, with the Arabic part included, and with the slogan being "Together Against Corona." Next slide. And now I'm going to talk about marketing and communication strategy. I'll give you some overview. And here I need to thank, first of all, Ms. Reem Salameh and Lisa Hamede. Lisa is also a student of mine in the Bachelor of Arts in Health Communication, who helped a great deal in developing the content of the marketing and communication strategy. I'll give you some outline here, what a communication strategy for an application is. Next slide. So the first step is defining the target audiences and defining also for them what are the goals and communication goals and objectives to achieve. We talk about positioning already, how the brand is conceived within the mindset of the users. Then we talk about the tactics, so we develop the tactics, how to promote the product, like the strategy itself. And then, of course, there's the launch of the application. Next slide. So we reflected on the target groups. So according with the discussion with the Ministry of Public Health, we agreed that there were two main target groups, which are the travelers of any age and gender, of course, visiting Lebanon could be for a specific period of time or for an extended period of time, and the citizen, of course. But with the citizen, within the citizen, we have subgroups, of course. We target more to the young generation, so Generation Y or millennials, those who are kind of tech savvy and know very well how applications work. We don't have to convince much them for downloading an application, but there might be other issues related to privacy concerns. Of course, we are addressing them. Then we have a Generation X, so those aged between 41 years and 55, who are highly educated, maybe parents of some of the Generation Y millennials, who use Facebook and WhatsApp at the same time, might not be familiar with applications like this. Then, of course, we need to address some issues related to crowding areas and areas with that are familiar with, let's say, a lot of people living together or people gathering, and this will expose them to the risk of contracting the virus, especially nowadays that people cannot stay home and self-isolate. So in this case, people living with preconditions and also at the same time probably having low socioeconomic status, not having access to the technology, this is something we need to consider. However, of course, by definition, we are targeting those who have access to the technology, and that this is nothing we can do about. Now, in terms of goals and objectives, of course, the main idea here is we need to persuade the target audience to download and activate the application. So there are two steps, the installation. So I download the application and then I actually activate it. I keep the Bluetooth on, and this is not an issue because we use Bluetooth in many things we do. Next slide. I think we mentioned already, so we try to rely a lot on the transparency, so having open communications, including establishing the expert oversight advisory board, publishing the privacy policy on the website and of course on the applications, and using open channels of communication. As you might know, probably we are on Twitter, we are overseeing most of the application comments on the application, and we respond to them. Next slide. Then I'm going to close here. The promotion channels we consider as mostly digital because we have limited resources available. Actually, there's no budget for the communication campaign. This is one of the challenges we're facing. We're going to try to get some free publicity through personal contacts, or radio TV stations will provide the ministry can provide the ministry with free public space in public service announcements. We will use and started using also text messages for designed from the Ministry of Public Health to be submitted to all subscribers in Lebanon through the mobile operators, and of course word of mouth and the so-called personal selling through volunteers. And we appreciate everyone diffusing this application as we go. Next slide, please. I think we mentioned already the challenges. The main issue here probably for me, it's the application has to be downloaded in full scale in order to be efficient. So the more people download the application, the better. And I'll let also others comment on this later on. I think we can close because we have 1 minute left. Next page. I wanted to stress this point that our work here has been guided by the principle of respect and fairness and the importance of reducing suffering from COVID-19. Of course, we want that everyone downloads the application, but it's voluntary. So we want to respect the fact that if people do not want to download the application, this shouldn't be mandatory. In other countries, unfortunately, this is not the case, and I would like to stress this point here. And the application, of course, is we want to help the Ministry of Public Health conduct the contact tracing in a more efficient way. So this is as a benefit from the community. And of course, justice, because this is an application free for all, and we don't want to restrict to someone in particular. I think I can conclude by saying, next slide, that's a matter of shared responsibility. And here this application for me and for us, I think it's a compromise between public health value and respect of human rights. Of course, we are open for discussion now, I think, for the value of the application, but I think I can say that it was a pleasure working with this team on this.
Thank you very much, Marco, and all colleagues for an insightful presentation on this exciting project. We have 5 quick minutes for a few questions. I can see in the chat box already Jumana Kalot asked about the number of users, and Lina answered that it's 17,688 users. Salim Adib is also asking whether you will start prompting random persons, not only those reported as carriers, to download the app. And he's saying that these are the ones who would really profit from the app. Not sure who would be able to answer this question from the team.
Marco.
Of course, I mean, I can take this. Yes, of course, the more people, so the random people, I mean, everyone who wants to download the application should download it now before testing, because when you test, it's really, so the application is too late in a sense to detect other people. So the value of this application is that it will start tracking as soon as you download it and other people around you download it. So if we are in the same room, physically distant, okay, we can still, exchange our numbers. I mean, the application exchange the random numbers, and then it will keep it for a while, as we discussed before. So if I tested positive tomorrow, you will be notified probably. And this is the value of it.
I want to also, Jumana, I'll take this opportunity just to also highlight and stress on the point that all the work done with everybody here, including TEDMob, was completely pro bono. So the funding, not only for the campaign is not there, none of this was funded in any way. And all the staff at the ministry was, doing all this as overtime work, really. And I see a question from Abla. I think this could be
yes, he's asking whether whether the app eventually answers the unanswered question in reference to the contact duration and the risk model. Heinrich, would you be interested in answering this question, please?
Well, I mean, so the Bluetooth signal, there are many things that the Bluetooth signal doesn't measure, right? It doesn't measure whether the phone and it's influenced by many things that it doesn't measure. So on some level, this will always be a crude proxy. So it will not answer questions about the detailed effect of distance on transmission risk, because we cannot infer the detailed distance. We also cannot infer the detailed contact duration, right? Since the signal is picked up every 3 to 4 minutes. However, I expect that our estimate of what type of signal patterns translate to a higher transmission risk will become better when we collect more data. So we will not be able to answer the question of how exactly distance influences transmission risk, because we cannot infer the distance very well from the Bluetooth signal. But I think we will become better at answering what kind of contact duration that we estimate, what kind of thresholds would best identify the high-risk contacts. Okay.
Thank you very much. I see also additional comments and questions in the chat. Salim has elaborated this question, asking, out of the 17,000 or so people who downloaded the app, what is the proportion of those who are not already carrying the virus?
So, Martin, I could take this. I think before I called you Jumana, that tells you how much you're staying with her, that I'm mixing you up. So, Salim, it's a good question. So remember that this is now public. So anybody could download it. We have no way for us to know, in a way, retrospectively, who have been infected at some point backward. If any of them test positive, once they downloaded and they're reported by the labs to the ministry, then we could know that after the fact. And that's why Marco was saying it's very important for people to download it now, And not really after they get infected, because it's too late. The contact had occurred in the past and we can't go back. The data has to have been collected on the phones beforehand.
I think I've heard, I can't remember who mentioned that right now about 10% of the people who are currently detected as contacts by MOPH have the app, right? Can't remember who mentioned that, Zainab maybe, or Lena.
And on one of the days, the
Okay.
hit rate came back that way, but it's, yeah, Lena
Okay.
maybe can comment on that more.
Yes, this is one day analysis of the data that came up. 10%, around 10% of the confirmed cases were using MAN application.
Okay.
But we don't have yet this figure to know exactly from all those using this application are already infected or not. We're trying to figure out. The day of launching, since 1 month, since 1 month from the date of launching of the application, we'll try to find out.
So,
Okay.
if I may, Martin, on Salim's question on those who are, again, who could be randomly prompted. So we do not have, and the ministry does not in its back end save numbers. So the numbers of the users of the app. So what reaches the ministry are the numbers of those who tested positive, which is a manual prompting, that then Lena feeds and her team feeds into the application again. So there is no way for us, Salim, to know beforehand from the users of the application whether they are positive or not, unless we get the information from the epidemiological surveillance unit.
Thank you, Aline, for clarifying that. I think we have to wrap it up at this point. Thank you, everyone, for joining our first webinar for this year. Salim, we will make sure when setting up the event next time to try and figure out how the list of attendees can be visible to all. Thank you all. Thank you for the team, for MAN application, the Humanitarian Engineering Initiative, and colleagues at FHS, MSFEA, and the Ministry of Public Health.
Thank you.
Thank you all. Thank you.
Thank you and bye. Have a good day.